Welcome back to the Human Anatomy and Physiology Lab. Today we're going to be looking at the vertebral column and the thoracic cage. When we're talking about the vertebral column, we need to talk about three types of vertebrae. The first set are the cervical vertebrae. You've heard when somebody has been injured and there is fear there may be a spinal cord injury, they'll put on a cervical collar. It protects the vertebrae of the cervical vertebrae in that area, the thoracic vertebrae and the lumbar vertebrae. Okay, let's talk about C1, the very first of the vertebrae, articulates, these condyles here articulate with the base of the skull. And we have this on this model here, C1, and this particular vertebrae is called the atlas. The atlas articulates with the base of the skull, and then with C2, the second of the cervical vertebrae has a dens here, this particular feature, and these two fit together and pivot oh so slightly. Okay, so C1 is the atlas, like holds up the world, or in this case, the skull. C2 is the dens, and there is a slight pivot movement between those two vertebrae. A slight movement between those two vertebrae, C1 and C2. Now, there is something very unique about cervical vertebrae. A couple of things unique and will help you to remember identifying cervical vertebrae. First off, there are 7 cervical vertebrae, and the 7 cervical vertebrae have features. This particular part is called the transverse process. The transverse process. The transverse, meaning from side to side here, process. A process is like a extension off of a part that comes off of the bone, usually for muscle attachment or ligament attachment, tendon attachment, but a process. Now, on the cervical vertebrae, there is a hole in that transverse process, and that hole is called the transverse foramen. Now, I've mentioned foramen again. A foramen is a hole. In this case, you have blood vessels and a few nerves that run up the neck to the head. And so the transverse process of cervical vertebrae have the transverse foramen. Here again is the axis, C2, and it also on its transverse process has the transverse foramen. Now, off the posterior side of a posterior part of the axis here, the C2 vertebrae, you have what is called the spinous process. The spinous process protrudes posteriorly from the vertebrae. These are all spinous processes. Okay, the spinous process. So this would be posterior, and the dens would actually be anterior toward the front of the body, posterior. Those are C1 and C2. I'm going to pick up another type of cervical vertebrae. Now you'll notice that the cervical vertebrae are small because the only weight they're having to hold up is the head. As you go down the vertebral column, the vertebrae are going to be larger. Now, this area of the vertebrae is called the body. Again, the transverse processes, either side, transverse process, and the spinous process. All right, there's the transverse foramen again. If I'm going to move a little bit closer so you can see, there's the transverse foramen right there. And there's a transverse foramen. Because it has the transverse foramen, we can name this a cervical vertebrae. Only the cervical vertebrae have that hole in the transverse process. And then again, you have this spinous process that protrudes posteriorly. Now, this is another feature that is unique to cervical vertebrae in that the posterior spinous process is forked. We call that bifid. So this is another way you can recognize a cervical vertebrae in that the spinous process is forked. The transverse foramen, or the hole in the transverse process, and the spinous process is forked. Okay? This is called the vertebral foramen. That would be the passageway for the spinal cord. And then this is considered the body, or called the body of the vertebrae. Now, the spinous process again is posterior. The body would be anterior. Okay? And again, this is a cervical vertebrae. Doesn't have to hold up much weight, so the body of this vertebrae is going to be fairly small. Now let's look at the next category of vertebrae. Okay, the first 7 cervical vertebrae. And as we go more inferior on the vertebral column, we will see the spinous process becomes longer, and the spinous process, where it's sticking out almost vertical, not quite, it begins to take a dip downward. So this is what it looks like. The spinous process points downward. If you'll notice, there are no, here's a transverse process, there's no transverse foramen. Okay, so this is not a cervical vertebrae. You have the spinous process that protrudes downward, it's long and pointed, and here's the body, vertebral foramen, and the body of the vertebrae. Still not real large, larger than the cervical vertebrae because it's holding more weight, but not as big as down here. So the next vertebrae, there will be 12 of them, will be the thoracic vertebrae. So the thoracic vertebrae have this spinous process that points downward. Okay, long. As you go lower and lower, they're going to become, the spinous process is going to become more blunt. Okay, and the lower you go, the more weight that vertebrae is going to have to hold up, so the body will become larger. Okay, 7 cervical, 12 thoracic. Now, as you go further down, still the spinous process protrudes downward. As you go further down, you're going to have a larger body because it's holding, again, more weight. Here's the transverse process, the spinous process, the body, the vertebral foramen, where we have the spinal cord coming through. These lower vertebrae are called the lumbar vertebrae. You have 5 of them. So 7 cervical, 12 thoracic, and 5 lumbar. These are actually, and I've mentioned this before, these are fused vertebrae that actually sacrum, and attached to the sacrum would be the coccyx. It is all the coccyx, like the tailbone, and it is a very small fused vertebrae. The sacrum are fused vertebrae, and the coccyx, or the tailbone, is on the lower part of the sacrum, and they are fused vertebrae. Okay, so 7 cervical, 12 thoracic, 5 lumbar, sacrum, coccyx. Look how large the body is on that lumbar vertebrae, because it's holding up the whole upper body. Okay, now the spinous process is different from the thoracic, different from the cervical, had the fork. The thoracic pointed downwards and was sort of long. As you go further down the vertebral column, they become shorter and more blunt. And when you get to the lumbar vertebrae, the spinous process is going to be blunt. Okay, shorter and blunt. All right. Now, let's turn this guy around here and let's talk about this thoracic cage. All right, of course, these are ribs. We already named this as the clavicle, the collarbone, the scapula, and this the sternum. It's really made up of 3 bones, but you just need to remember sternum. Now, directly attached to the sternum by way of cartilage here is the first rib, is attached to the sternum, so the ribs. And actually, this is a fixed joint, and these are considered, the rest of the ribs are considered a synovial joint. But those ribs that are attached directly to the sternum are called true ribs. Those ribs that are attached to cartilage, that is attached to costal cartilage, that is attached to the sternum, are called false ribs. Okay, directly attached to the cartilage that's attached directly to the sternum is a true rib. And for these that are attached to this cartilage, that's attached to cartilage, not directly attached to the sternum, are called false ribs. And if you look closely here, you can see that there are some ribs that are not attached to the sternum at all, or indirectly to the sternum. They're not attached to anything anteriorly, only to the vertebrae posteriorly. These that are not attached in the front are called floating ribs. It's a type of false rib, but it's called a floating rib because it is not attached to cartilage to the sternum, or cartilage to the sternum. So true ribs, false ribs, floating ribs. Here's the sternum. Okay, the clavicle, the scapula, ribs, sternum, true ribs, and those that are not attached directly are called false ribs. And a false rib that's not attached at all, we call that a floating rib. True, false, and floating. Here's a smaller floating rib right here that you can see. This is the thoracic cage. Now let me go back and say real quick, a good way to remember the number of the vertebrae is remember breakfast, lunch, and dinner, 7, 12, and 5. Just the right time to take a break and go eat breakfast, lunch, or dinner.